This morning, Surgeon General Vivek Murthy just issued his first advisory of the Biden administration. The Surgeon General sounding the alarm on a different kind of invisible threat to public health: misinformation. Murthy says it is the moral and civic responsibility of every American to fight health misinformation, which he calls an urgent threat, particularly as low vaccination rates in some states are leading to spikes in new COVID cases. I want to bring in Dr. Uche Blackstock. Dr. Blackstock is the founder and CEO of Advancing Health Equity. She's also an MSNBC medical contributor. Doctor, first of all, just your reaction to this new advisory from the Surgeon General.
Well, I think it's incredibly important. I think it's much needed. Misinformation is harmful, and misinformation is killing people in this pandemic. When we look at the polling for people who remain unvaccinated, they have a lot of false fixed beliefs about vaccines, about the COVID-19 vaccine in particular. Many of them get information from social media, and there also are larger organizations that have had a concerted effort to disseminate anti-vaccine information. So I think that this call by the Surgeon General is timely, and we're going to need it in terms of this next push to get people vaccinated.
But here's the thing, Dr. Blackstock. I mean, these wacky people that believe all this nonsense on Facebook, or the conspiracy theorists, these are the same people that believe that the government's kidnapping children. These wacky people who believe this nonsense. And in the past, it's just, you sort of point at them and laugh. But now, to your point, it's leading to people getting sick and people dying. How do you combat that? How do you fight misinformation?
Right. And that's the other thing. So there are regular, normal people, our neighbors, our coworkers that are absorbing this misinformation. And so according to the Surgeon General, we all have a role to play as individuals, ensuring that we are accessing and reading responsible and correct information, but also even media organizations. We have a responsibility to make sure that the information that we're presenting about vaccines is clear and concise, and that we, more importantly, are answering the questions that people out there have about vaccinations. And so there's a role for sort of everyone within society to counteract misinformation. But I agree with you. I think it's going to be a challenge.
So we heard from the Surgeon General on this urgent threat. And then this morning, the CDC director, Dr. Rochelle Walensky, she had a dire warning of a potential fall surge if vaccination rates don't rise. This is part of what she said.
What we do know is these respiratory viruses tend to prefer the winter, fall weather, and they tend to circulate more when we're indoors in the cooler weather. And so what I'm really hoping now is, as we're starting to see these cases, that people will take the message, see that they don't want this to go on, and to really go and get vaccinated now so we can prevent what could happen in the fall.
How concerned should we be about the fall?
I think we should be very concerned. We're already seeing outbreaks throughout the country, mostly in the Mountain West, Midwest, and the Southeast. And these are areas and pockets with a large number of unvaccinated people. We know that children under 12 are not yet eligible for vaccines. And so I worry significantly about school settings, especially in states that have pulled back mask mandates, including in schools, and what's going to happen this fall. Undoubtedly, we are going to see upticks, but hopefully not surges, but we're going to see upticks. We really need people to double down on the public health measures. Those are still important. Masking, physical distancing is still important, especially in areas where there are a large number of unvaccinated folks.
There's also this new report in the Lancet Medical Journal that millions of children around the world missed crucial non-COVID vaccinations over the past year. As you point out, schools are about to reopen here in 4 or 5 weeks. How concerning is that?
Right. And we see the pandemic has caused harm in many different ways. And in this way, it's caused harm in that children were not able to get their usual typical childhood immunizations for pertussis, diphtheria, polio, for diseases that are pretty non-existent. And the sad part of this is a lot of this occurred in areas in low-income countries, in the Mediterranean, in the Southeast, where the public health and healthcare infrastructure are already quite weak. And so, obviously the concern is that as COVID-19 continues to surge across the world, that children in these areas will be even more vulnerable if they're not getting their vaccinations.
In the New York Times, Dr. Blackstock, David Leonhardt, he reports that there may be some mixed news on this Delta variant this morning. Quote, "It is significantly more contagious than even Alpha by almost every measure. It does not appear to be more severe based on the data available so far." And we talk a lot about how contagious this Delta variant is, Dr. Blackstock. But for our viewers and our listeners on Sirius Satellite Radio, in plain terms, explain how much easier it would be for someone to get this variant strain of COVID than what we were dealing with this time last year.
Right. So the wild type coronavirus, if a person was infected with it, they could infect about between 2.4 and 2.5 people. With the Alpha variant, they could infect about 4 to 5 people. However, with the Delta variant, if someone is infected with that variant, they could infect up between 5 and 8 people. And so while the variant may not be more deadly, meaning it may not cause people to be hospitalized more often, you do end up with more people being infected. And so that is the difference. And so, but we still know that those prevention measures, masking, physical distancing, getting vaccinated, especially fully vaccinated, are effective against the Delta variant.
Dr. Uche Blackstock, we'll have to leave it there. Dr. Blackstock, thanks as always. Thank you.
Thank you.